I'd like to introduce Mark Becker, the 7th president of Georgia State University, who began his tenure here January 1st, 2009. Under Becker's leadership, GSU has overseen the launch of a variety of research initiatives focused on excellence among faculty and students. These initiatives, the cornerstone of which is the university's strategic plan, was adopted in 2011, are aimed at positioning GSU as a premier urban research university. Please welcome the president of Georgia State University, Dr. Mark Becker.
Well, thank you, and good morning, and welcome to Georgia State. Probably the only thing that even a little bit qualifies me to be here with you this morning is that I once did play the role of a dean of public health earlier in my life at the University of Minnesota after spending a faculty career in biostatistics at Michigan. But what I want to do here this morning is welcome you to Georgia State, tell you a little bit about the institution and about some of the things we've been doing that actually may translate into some of the things that you're going to be talking about, as well as one of our initiatives, which actually ties in very beautifully. One of the initiatives in our strategic plan ties in beautifully to what you're going to be talking about. So first, I want to thank Dr. Satcher. It's a pleasure to have him here at Georgia State. He's truly a great American. I had the pleasure during my tenure as dean to actually overlap with his years as Surgeon General. And so I thank him for his leadership and for all he's done for the country. Please join me in thanking Dr. Satcher again. Now, some of you are what I'll call old friends, meaning you have close colleagues and friends here at Georgia State, and some of you are perhaps new friends. But welcome to all new friends as well as old friends. And I want to acknowledge my colleague Jazz Alawalia, who I overlapped with in some significant ways in my tenure at Minnesota. And he was still at Kansas at the time, but we've been friends for a good number of years. And it's great to see you in Atlanta, Jazz. So welcome. And it's good to see you here. So Georgia State University, and Dr. Satcher in his talk alluded to this, and I couldn't miss his talk. I actually left another meeting early because I wanted to be able to hear what he had to say because he's always profound, and his message is always very important and very clear. But he also picked up that this is our centennial year, 100 years of Georgia State University. And that's actually true as we celebrate it, but it's not exactly true. And so let me give you a sense of where we started and where we've come to, because it's going to get us to why you're here and what you're talking about in this conference, in this symposium. 100 years ago, 1913, a group of leaders got together and said, we've got a problem, and that is a lack of access to education. And at that point, the lack of access to education was for a particular and small group of people. And they were the businessmen who ran the businesses in what was then downtown Atlanta. And downtown Atlanta at that time was the hub of economic activity in the city. There was no Buckhead. Midtown was very different. It was a very different place in 1913. But these people that were running these businesses, as much as they were the economic engine of the city and the economic vitality of the city, they had no formal education in actually how do you develop, run, and grow a business. And there was this burgeoning new body of knowledge on the science of business. And I don't remember in academics, we always have jargon. I don't know what the jargon was in 1913. But they decided they would do this. And so at that point, what was then what is today is the Georgia Institute of Technology, the name was slightly different in 1913, opened an evening school of commerce in a rented building in downtown Atlanta and enrolled approximately 48 white men. And that was the entire student body, and that was the entire focus. Now, I'm not going to go through all 100 years, and I'm not going to go through all the transitions, but let me talk about who we are, where we are, and what we're doing today, because it's a long way from 48 white men in 1913 doing just commerce. So to start with, Georgia State University today is 32,000 students strong, approximately 3/4 undergraduates, 1/4 graduate students. It is, I will claim, and I don't have all the data because they don't actually put them out exactly this way, but I will claim we are the most diverse university in America. We do not have a majority student population by race or ethnicity. It's approximately 40% Caucasian, roughly a third, a little bit less than a third African American. We're in the range of 12 to 15% Asian American. We are in the range of 8 to 10% Hispanic. We were 8% Hispanic 2 years ago. It's almost certain that our freshman class this fall will be 10% Hispanic, if not higher. 5% of the students a few years ago reported themselves as mixed race. Okay, and that's just the Americans. Another 1,000 plus students are international, representing in a typical year anywhere from 120 to 150 nations, so much of the world. It's a very diverse place. It's a place where diversity is considered the strength of the institution, and actually something that we're very proud of, because it basically says that this university is the future of America. This is the university. If you look at what the future demographics of America look like, they will catch up with us eventually. They will catch up with us eventually. Okay. But I want to say something in the area of disparities, and something that Georgia State has done. It's not health disparities, but I think there are actually some transferable lessons. I think there's actually some things that we have done around disparities that can be translated in some positive ways to health disparities. There are certainly going to be important differences, but that's educational disparities. Okay, so we're diverse. Georgia State has started becoming diverse a long time ago, particularly as it pertains to Caucasians and African Americans. The growth of the Hispanic population is more recent. The Asian population, I think, ticked up, probably starting with the large wave of Vietnamese immigration into the area, as well as all other populations in the Asian subcontinent. Okay. But if you go back 10 years, actually if you go back 15 years, I want to start 15 years ago, only about 22% of the students who started their education at Georgia State would have graduated 6 years later. Okay? That was just the entire student body. You go back 10 years ago, that had gotten up to about a third. But it was different for African Americans, it was different for Hispanics, it was different for Caucasians. Caucasians had much higher graduation rates than African Americans and Hispanics. That is no longer true. We have completely eliminated the disparities in educational attainment in our student body based on race or ethnicity. But the key, I believe, is not that we've done it, it's how we did it. I've been told numerous times at national conferences they would like me to come up and talk about the things that we did for African American students and the things that we did for Hispanic students to eliminate these disparities. And I tell them I would be happy to talk about that, but we did not do a single thing based on race or ethnicity. We did not do a single thing, with one exception, and I'll mention that one exception in a minute. What we did do is we focused on our students. We got to know who our students are, and we got to know why they were not completing college, regardless of race or ethnicity, because the issues actually did not come down to the color of their skin or the genetic background of their parents. The issues came down to a variety of different factors. Some of those factors were academic, some of those factors were not academic. So one of the other things we did not do is just say we have to teach students to be smarter and study harder. We did some of that. We did a lot of that. We do a lot of brought in a very proactive set of initiatives to help intervene before students get too far behind. Okay. But we also went outside the academic circle and asked ourselves the very basic question: what is the number one reason that a student drops out of Georgia State University? Remember, at the point we started this, 2/3 of them were not making it to graduation. The number one reason was financial. It was financial. And it was not just lack of access to money. That's a factor in it, but it was not just that. It was a lack of skills at navigating the financial systems available to students, and it was a lack of financial literacy. What do you do when you have a student who is leaving school because they're so far in debt and they can't afford to stay in school any longer, and you look at what they've been doing, and they've stayed in the most expensive dorm room with the most expensive meal plan? That was not a good choice. Okay? So what we've done is we've looked at, put the student at the center, with the goal being student success. It's the number one goal in our university strategic plan, student success. Put the student at the center and asked, why are they not completing? And then let's get from there to there. There was a question earlier about research. Of course, what I do, I have to like research. So I will join with Dr. Satcher in saying research has been a part of this. What we've done is we've not had a grand program. We have not had one big initiative and announced, said this is going to be, the war on dropouts or whatever. What we've done is we've taken the challenges in this particular case and picked areas where we could intervene in ways that we can afford, because Georgia State is not a rich university by any stretch of the imagination. And we've done most of this in the time that our state budget has been reduced by $45 million, and we've increased student enrollment by 4,000 students. But what we've done is we've done a combination of active intervention and experimentation. So let's take an issue such as a student who comes in with a Hope Scholarship. Those of you that are from Georgia know that a student who graduates with reasonably strong academics in this state has a Hope Scholarship. It doesn't pay all their tuition, but it pays a good chunk of it. And for a student who comes from a low-income family, that's very important. But you can lose that scholarship in the state of Georgia. So we implemented a program because the students who lost the Hope Scholarship were leaving. Almost none of them were staying. Very small numbers, less than 1 in 4. Okay. Let's try an intervention. We call it Keep Hope Alive. Not a bad name for a program. Keep Hope Alive. Now, we don't have the resources to replace their Hope Scholarship. But what we do have is a little bit of money. And we entered a partnership with the students in the pilot. This is where the research comes in. We do not roll out any of these interventions without doing an experiment first. We do an experiment first. Maybe 50 students, maybe 100. It depends on the program. It depends on the financial circumstances of the program. We do an experiment. We run it for a while. It takes time to get results. And then we see if it worked. And Keep Hope Alive works. So Keep Hope Alive was not the multiple thousands of dollars that the Hope Scholarship was. It was $500. And in return for those $500, the student had to commit to doing a certain number of things that would help themselves. Study skills, financial literacy, much more active involvement with their advisors, et cetera. So that's just one little example, and that's that research piece. We look at the research of what's working at other universities. We don't assume that works at a flagship university that's a land-grant institution in a rural area will work for us, but we look at the research, we design the experiments, and we intervene. So where we've gotten to today is not only have we eliminated the disparities in graduation rates based on race and ethnicity, we have actually taken the graduation rate for students who start at Georgia State over 50%, which is not something that we're going to celebrate because we're not done. We're going to go much higher than with that, from 20s to 33% to 51%, the most recent cohort. But if you actually look at the students who are no longer here that started 6 years ago and put them in with those who have finished, actually 3/4 of the students who started at Georgia State 6 years ago have either graduated from Georgia State, another institution, or are still going to school. Our goal, of course, is to get our own graduation rate up in the 60, 70% range eventually. We don't assume that everybody will stay here in America. On average, a student attends 3 institutions. In fact, for many students, Georgia State's their second institution, whether they've gone to Georgia Perimeter College, Atlanta Metro College, which are 2-year institutions in our area or elsewhere. And we don't assume they'll all stay. If they decide they start in physics, they want to be an engineer, we can't serve them. They'll head off to Georgia Tech, et cetera, et cetera. But we do expect that eventually everybody who starts with us will graduate somewhere. And we have to get them off on the right start and get them well on their way so that if they do leave us, they leave us to be successful, not to drop out, stop out of education. Okay. The other thing that we've accomplished is we've done all that where over half our students are low income. Over 50% of Georgia State students qualify for federal Pell grants, which means as far as the United States government is considered, over 50% of our students are low income. 50% of the people who start college in America graduate from college, and that's everybody. Taking a student population, working with a student population where 50% of it is low income, and half of them graduate here and a quarter elsewhere is actually quite remarkable. It's something we're proud of, but we're not by no means stopping. And so in 2011, when we rolled out our latest strategic plan, student success is our #1 goal, and we're continuing to innovate, continuing to do new experiments, do new experiments and continue moving that needle, keep moving it up so that eventually the majority, 60% in the near term and hopefully someday 70% as we get to the next strategic plan, will finish with us and 100% will graduate somewhere, because that is our goal. Our goal is if we admit you, we've already said you have the ability. Now, it's a compact. There are things the student must do to be successful. You don't buy an education. You're a participant in education. But if we admit you, you have the ability, And we, as part of our programs, are to help you get to that success line as long as you help yourself. Also in our strategic plan, and we'll tie what we've done in student success in with other parts of what Dr. Satcher talked about and what you'll be talking about today. We have another goal as a research goal. We're a research institution. We're not going to stop doing research. In fact, we're growing our research. But an important part of whatever you want to do if you want to change the world is you got to change yourself and change what you're doing. We had a strategic plan not in 2011, but in 2005 that said we're going to take our research funding base up to $100 million a year. In 2010, when we went into strategic planning, our research funding base was exactly where it was in 2005, which was a lot closer to $50 million than $100 million. And I stood on this stage as we kicked off the strategic planning process and said that things are going to have to change around here. You know, it's Einstein's definition of insanity, to keep doing the same thing and expect different results. Okay? You have to do things differently to get different results. And I think that resonates with what you're going to be talking about, of course. And we've already seeing success there. 2013, 1 year into the strategic plan, the FY13 year, research was up 14%. This year, we're up 30% year to date. And any of you who are in a research environment know that federal funding has been flat at best. Okay, so we are changing things and we're getting results. Again, getting down to the basic issues of what do we need to do, not sweeping programs, getting down, understanding at the ground level what we need to do, implementing change and making it deliver. Innovation in education is another one of our 5 priorities. We don't allow more than 5. You've got to be able to count them on one hand. Okay. Innovation in education, some of that relates to this audience. We have a Bachelor's of Independent Studies program, which has become a vehicle for experimentation. Again, that theme of experimentation and research. And that vehicle is going to relate directly to what you're talking about because it's going to open up undergraduate opportunities in public health education and undergraduate opportunities in health informatics. 2 very important areas for this community, for this region, really for our nation and the world. Fourthly, and again, it shouldn't surprise you, everybody's doing it. Dr. Satcher talked about it, and that is the global piece. Think globally, act locally. We have to prepare our students to work in a global society. Whether you're working in infectious disease or you're working in finance, you're working with a global environment. And it's our responsibility to do everything we can to prepare our students for that new world, that brave new world, which is, if Tom Friedman says it's flat, how many people, the earth is flat? Tom Friedman's wrong. The communications infrastructure is flat. The ability for viruses and bacteria to get from one place to the other is relatively flat because of transportation. But the earth is spiky. The earth is spiky because the earth is emptying into the cities. The United States of America is becoming more urban. Asia is rapidly becoming more urban. Africa is becoming more urban. Europe's already well down the curve of being more urban. The earth is spiky. And our 5th initiative, which is one that's distinct for us because there's no other institution, at least no public institution in Georgia, that can have this as their goal, and that's cities. So identifying, working with others to find solutions to the challenges facing cities. Okay. That was not a no-brainer when we did our strategic plan. It was actually something, this is one of the leverage points you get of being president of the university is you can tell them they got to do something. And so I told the Strategic Planning Committee, I want a cities initiative because we're sitting here in downtown Atlanta and we're not doing very much taking advantage of a research environment, an education environment, a partnership and community environment. And the committee, which Michael Erickson, the Dean of Public Health, sat on, they went with that, they ran with that, they did surveys, they did focus groups, they did everything, and they came back about 8 months into the process and said, we've got all these great things about student success and research and academic innovation and global, but we just can't get excited about this cities thing. It's because we didn't have it. It wasn't entrenched within the culture. And so we had it was a come to Mark moment. I looked at him and I said, that's fine. You take that out. You can take this strategic plan, which you've written. This is all good stuff. And you can run it up to Midtown and hand it to Georgia Tech and they'll put their name on it and it works. Or you can take it up to Athens and hand it to the folks at UGA and they'll put their name on it and it works. because everything in here is in every strategic plan of every public university in America. Nobody's not working on student success. Nobody's not working on research if you're a research university. Nobody's not trying to innovate, particularly as technology is rapidly changing. What and how and can we do in education? I don't know any major institution that's not talking globally and growing globally. But not everybody sits where we sit. Not everybody sees the challenges and has the opportunity to touch the challenges in such a way that we can actually move the needle and help find solutions. And so the city's initiative survived, and the interesting thing, it's become the one that folks are getting very excited about now. But it's not easy because we were not set up organizationally for that. And so this is taking longer than some of the other things to show success, because our goal is this has to be interdisciplinary. You're not going to solve the issues of transportation and lack of affordable housing and lack of access to food or affordable food and good food and all those other issues that plague our cities. And it's not just our cities; it's the cities all around the world. You know, you can go to Beijing, Shanghai, Sao Paulo, on and on and on. All the cities around the world. These issues are not unique to us. So our responsibility as a university is not to be the service provider that will fix everything, but it's to identify within our walls, within our expertise in faculty, in public health, and sociology, and psychology, and economics, and entrepreneurship, and all these other areas, to bring together those folks, identify where we actually have the assets, the people, the funding opportunities, whether it's through competitive research grants, access to populations, large numbers of students who are motivated and excited to dive in. Bring all that together and find out where we can move the needle and find out who our partners are. So that's why I wanted to talk about this. We cannot do this alone. We will have to partner with others. We'll have to partner with others here in Atlanta to do things here in Atlanta to see what works. And we will have to partner with other universities across the nation and across the world, because what we're talking about is at the experiment level, fixing a neighborhood, whatever that means, moving the needle, improving health outcomes, reducing disparities, eliminating disparities in a neighborhood. But this is a research environment, it's an educational environment. If we don't do it in such a way that it's reproducible and scalable, we will have failed. Okay. That's what we have to do. And it's exciting to be here watching the faculty and watching our faculty in public health, because they're right at the heart of this. They're right in the middle of it. This particular program on health disparities is a very important component. That's one of our areas of focus. It's not our only opportunity. We're not going to do transportation. We're not Georgia Tech. We don't have the big research institute. We're not going to solve that problem. But we might be able to see how we can address part of that problem as it relates to disparities in health or access to health. So I think I'm just about used up all my time, my welcome time. So I will close in saying that I need to look at my notes for 1 second, see if I had anything profound to say that I did. Yeah, I made a note that I wanted to make sure I got to. Dr. Satcher mentioned the relay race. Well, I also was a runner, but I didn't run relays. I was a distance runner. And so I think the trick of what we're into in trying to solve the challenges of cities, address health disparities, eliminate health disparities here in Atlanta, nationally and globally, it's a relay race, but each leg is a marathon. It's a relay marathon. You know, moving that needle, we didn't jump from 33% graduation rates to 50%. We went from 33 to 35 to 38, blah, blah, blah. But eventually you gain momentum. You get faster as you go. And that's the key, was we have to get faster as we run the relay marathon. And that's possible. It's possible by getting the right people together, resourcing them appropriately, and maintaining, and that's the marathon part, maintaining that commitment, maintaining that focus. I think one of the biggest challenges we face in a problem as big as health disparities is losing focus. You start off down a road and all of a sudden somebody wants to go over here and somebody wants to go over there, whether it's a federal priority, whether it's the makeup of the team that you've got working. It's trying to get clear about what the outcome is. We would not have gotten where we've gotten with our graduation rates and eliminating educational disparities if we hadn't made sure our focus was always on getting students to graduation. There's always lots of other trends and changes in the literature that come up along time, but it's getting that focus. And so it is getting that clarity of what is the problem we're trying to solve. And then looking at a multifactorial approach of different little experiments growing into big sweeping programs. So welcome, delighted you're here, and hopefully this is the beginning of many great things for all of us, because this work is much needed and it's important, and you can and you will make a difference. Thank you so much for having me.